medical laboratory science, clinical laboratory science, biomedical science, whatever is called in any part of the world, the constant there is the word science. And this is because medical laboratory science is the science of medicine. In fact, there's a popular saying, you ask your doctor will ask a medical laboratory scientist. Joining us today is the former chairman of Association of Medical Laboratory Scientists of Nigeria, FCT chapter, and the immediate past National Publicity Secretary of Association of Medical Laboratory Scientists of Nigeria, Dr. Casmir Ifeanyi, and we'll be talking on the journey so far, achievements, challenges, and the way forward for the profession. My name is Ekwi Onyekwele. This is the White Coat Report. Thank you for joining the conversation. We'll be right back. You're welcome, sir.
It's a pleasure to be on your platform.
Right off the bat, I'm very much fascinated by that statement. You ask your doctor will ask a medical laboratory scientist. So what does that really mean in terms of patient care?
It simply means that your doctor is less than a soothsayer without medical laboratory science. What do? The doctor can only see you while you are seated in his consulting room or lying down during a ward round. But the medical laboratory scientist continues to look after you even when the doors of the hospitals are shut and when you have gone back to your home and on your bed. We continue to look after you. We look at your specimen, and as we look at your specimen, body fluids, blood, urine, tissue, we characterize you. We can say the disease you have, predict the disease you will have in the future, and of course, determine the drugs that can make you well.
Looking back at the journey so far, what started out as a trainee program and then now a full force, an indisputable pillar of patient care in Nigeria, would you say that the growth has been impressive?
Every profession across the globe had humble beginnings. Before the medieval age, we hadn't more than 3 professions. You are either a teacher, a priest, or a lawyer. And so if you look at professions, these 3 are the oldest. Medicine evolved. And in the process of the evolution of medicine, other professions that have their roots also in medicine evolved. One of them, and cardinal to care, is the profession of medical laboratory science. The simple summation is that it's a distinct profession with clear-cut scope of medical education for the provisioning of quality health care to patients.
You mentioned medical laboratory science being evolving from medicine, right? The rivalry in the health sector is very, very popular. Everybody knows about the interprofessional rivalry in the health system. Is that a detriment to the development of medical laboratory science?
From the authorities, and what I mean authorities, from body of literature, some of which I came on this stage with, medical laboratory science, clinical laboratory science never evolved from medicine.
Medical doctors will argue, they will say that the doctor used to do everything
That is what they will say.
The doctor used to constitute drugs. He used to...
That is not true.
Okay.
I have said that from the body of literature, and like I said, I came with some. This one was written by an individual. This is the history of medical laboratory science, the Nigerian perspective. This one is a corporate publication of the Association of Medical Laboratory Scientists of Nigeria, and it speaks about the evolution of the medical laboratory science in Nigeria. Now, like I said, earlier on in life, we had 3 professions. And so when other professions started evolving, medicine evolved. And professions also that have their foundation in medicine evolved equally. What do I mean by that? Before 400 BC, we have had attempts to use body fluids to dictate what is wrong with an individual. If you take a copy of the Hippocratic Oath and study, you will find out that what was medicine? Medicine was confined to bedside attendance to patients. And it is still contained in the Hippocratic Oath today. That is why when new graduates of medicine are being inducted, they say any house I will enter, because then it is either you are seated beside the patient to give care as a doctor, or you go to people's home when they are sick. The going to home is what led to a situation where we have now wards and patients lie in and doctors come forward round. There had been no science. The building block, the founding block for medicine is that medicine is an art, is a skill, and its foundation is on sense and mind. Therefore, no science.
So medical laboratory science, the science of medicine.
There to be evidence-based medical care. That was the reason for the evolution alongside medicine, medical laboratory science. Doctor job, permit my word, was only on the perspective of mind and sense. Highly subjective. They now knew that there were people with knowledge, competencies that will complement their duty. And so the two evolved together into what we have today.
To what extent do you think this rivalry has affected the full bloom of laboratory science in Nigeria?
It is the Yahoo and Indomie type of doctors that is the problem in Nigeria.
Did you say Yahoo?
Oh, Indomie type.
And Indomie type.
The Indomie type, the noodle type. Because I have mentioned a revered person like Professor Dozien, the sitting reigning regent of Asaba, the Asaba of Asaba. These were men, a pathologist, what he sought, a doctor therefore, that pushed for the commencement of the first ever bachelor's degree in medical laboratory science in Nigeria. And they graduated their first set way back in 1971. And so, if you say that all doctors are fighting medical laboratory scientists, that will be wrong. These men committed to developing the profession, and he pushed for it, and they started. Well, a whole lot happened, and that program was scuttled. I had to mention him to point to the fact that before now, we worked as brethren, hand in glove.
Hand in glove. Like that. So the blame is on the present
I told you is the
health workers now.
When I use Yahoo, you are not happy. The
yes.
Indomie age doctors and Indomie age medical laboratory scientists are the ones stoking the embers of discord and rivalry. Okay. Because the truth is this. to every coin, there's a two side. In every argument, no side is the complete side. Because I have my perspective, you have your perspective. We can only have the holistic perspective when the two is merged. So the doctors who have their perspective of we evolved medical laboratory, and they carry it on and think that they will kill the profession. The world is beyond Nigeria. In the United Kingdom, today, we have the Royal College of Pathologists and the Institute of Biomedical Science, London, working hand in glove to promote medical or clinical laboratory science and to promote pathology. The truth is this: it is only in Nigeria that the word pathology is an appellation reserved for people with MBBS degree. If you go to Canada, if you go to the United Kingdom, if you go to the United States, pathology is a wide field of endeavor, is a wide field of study dealing with the cause, pattern, and progression of disease, a study of it.
I think this mention of pathologists, let me ask you a question. Do you think medical laboratory scientists in Nigeria have a clear-cut career pathway? Are they able to attain the peak of their career in this country?
The answer is no. I will tell you why. I have a friend and a brother who left the shores of Nigeria after graduating in medical laboratory science from the University of Nigeria in Soka. He went to the UK and he entered the service in the UK and did the clinical laboratory scientist further training, and that qualified him to examine and treat slides, pathological slides. That's not happening in Nigeria. I have a personal friend, Dr. Brenda. Dr. Brenda has a Doctor of Clinical Laboratory Science degree, which is an equivalent, or is a doctorate, and therefore heads the pathology lab in a state in the US.
Heads a pathology lab?
Yes. There's a deliberate program in the United States today. I have documents to show. What are they doing? Recruiting medical laboratory scientists to train them in all the duties of a pathologist. Do you know why? So the pathologists, which primarily are physicians, can be freed up from the bench to stay in their lane. What is the primary duty of a pathologist? The primary duty of a pathologist is that he is a physician. The primary duty of a physician is to give care and not to sit on the bench to mix one meal with two meal, or to flood crystal violet and replace with Lugos iodine. These are not the duties of a pathologist. It's demeaning for the Nigerian pathologists to be jostling for the bench and space in medical laboratories with medical laboratory scientists.
Is there a monetary attachment to it in terms of, is it a title or is it a monetary
I have said in a few of my public outing and press briefing that it is the quest for a futile liquor that is behind the interest of pathologists in the laboratory, not so as to provide service. Growing up and training in Enugu, I can mention pathologists here who had their clinics, not laboratory days. It was clinic days, and patients went to consult them with their laboratory reports. The primary duty of a pathologist is to help his other colleagues, gynecologists, internal medicine people, pediatricians, what have you, to understand the language we speak in the laboratory so they can translate that to the decisions they make for care. That's not happening in Nigeria. In the olden days, of the UCH Ibadan, the Adoye General Hospital that metamorphosed to University College Hospital Ibadan, where we had people like the golden voice of the Senate of the Red Chamber, Senator Professor Olushola Adeyeye, hold sway when UCH was working, when they had a tissue culture laboratories, had all manner of things, electron microscope and all that. It was called pathology division, it was called pathology department, but who were running the show? Medical laboratory scientists. Because the pathologist's place is in providing care. He is primarily a physician, not to come and sit in to begin to interface with contractors. These are the attractions. To begin to find how they will manage laboratory revolving funds. These are the attractions. Okay. I tell you the truth.
So
if we go to
profession, laboratory science,
yes,
is it progressing now or is it regressing?
Oh, in Nigeria,
yes, in Nigeria.
I must tell you, medical laboratory science in Nigeria is blazing the trail, at least in the African continent. I'll give you an example. Today, we have the Doctor of Medical Lab Science degree being awarded by a university in Ghana. We developed the curriculum in Nigeria. Politics came in because the people we're talking about, our brothers, doctors, felt that the word doctor it should also be an exclusive appellation to them, another misnomer in Nigeria. And so they frustrated the approval of that program by NUC till date. Ghanaians came here, pleaded with us, borrow us that your curricula, and we borrowed it to them. Today, Nigerians are going to Ghana to train to, yes, of course, I know a lot, to train to get the Doctor of Medical Lab Science degree, and they will come to enter our service here. So what will you call them? Doctor of Medical Lab Science. And so, that's not the only country that came. Kenya came. So in the African continent, medical laboratory science is more advanced in Nigeria than any other part of the world.
But then the interprofessional rivalry, we don't let it.
You see, the interprofessional rivalry is not hindering the blossoming, okay, but it is robbing the Nigerian people the value we bring to care. Okay. It's robbed the Nigerian people the value we bring to care. And that's important.
Yes. So I was going to ask you the challenges. So from what you've said, am I right to assume that the greatest challenge facing the profession is this rivalry with medical doctors, or is there any other challenge you think supersedes?
The challenge for me is not about how the profession will grow.
Yes.
Today we have the highest number of academic PhDs in the health sector.
Wow, I didn't know that.
Yes. No other profession, including medicine, can boast the number of PhDs in medical laboratory science profession as we have. Now, this is the problem I have. The problem I have is that whereas pathologists have abdicated their duty, they have come to obstruct service, medical laboratory services in Nigeria. Today, pathologists claim that they want to head all the laboratories in Nigeria. No government-owned laboratory, apart from the military 44 hospital, that have any accreditation for their laboratory. No government-owned. Why? Because pathologists have blocked the process. You can't give what you don't have. They should go and care for patients. Allow medical laboratory scientists to drive medical laboratory services. It's a profession distinct from medicine, but it's a profession that is critical. That brings, it is the Lord Star of medical care. Medical lab science is the Lord Star of medical care. So, having said that, the rivalry, yes, is a challenge. Why is it a challenge?
Is it the biggest challenge?
One of them, the Minister of Health, because he's a doctor, issued us a memo a couple of months ago, sometime March, April this year, that he has no need in his ministry for the Department of Medical Laboratory Services. This is what was approved way back in 2006 by the Federal Executive Council and was adopted for nationwide implementation by the National Council on Health in 2007 at Sheraton Hotels and Towers, Abuja. The city minister today has said to the whole world that he has no need for a Department of Medical Laboratory Services. That is very disheartening. I tell you why. A lot of what we do in Nigeria are donor funded, development partner funded. These ones are very skeptical about, as a result of that position assumed by our minister. Honestly,
how do you subtract medical laboratory science from patient care?
I do not know.
No,
so it just gives you the corrupt mindset of the average Nigerian doctor of today, not of before. A few of them understand. You know why? Let me tell you and tell our viewers something. My theory, I have the 470 theory. First 70, and I can provide literature evidence for it. 70% of all clinical decision for the management, treatment of and diagnosis and treatment of patients stem from laboratory data. 70% of all data for national planning, health planning, come from medical laboratory. 70% of all electronic medical records about patients are data from the laboratory. 70% of all healthcare revenue, any hospital disaggregate their revenue, 70% of the revenue generated by the laboratory. That is the attraction for our brothers pathologists to come and control.
What do you think is the biggest achievement so far?
Oh, we achieved those in the 90s.
Oh, wow.
Yes, we're retrogressing now. And
that was a question I asked.
And I'll give you I'll give you examples. Today we import all the vaccines we need in Nigeria. The production of vaccine, human and animal, were started and were driven by medical laboratory scientists. Some are dead, some are living. Nigerian medical laboratory scientists. For example, up until 1991, we produced yellow fever vaccine in Nigeria, rubella, smallpox. We were producing all these vaccines in Nigeria. And who were the drivers? People like M.O. Nwachukwu. God rest his soul. He passed on last year. Sir M.O. Nwachukwu drove the process of WHO pre-qualification of Nigeria as the sole producer of yellow fever vaccine that was used to contain the very last yellow fever outbreak beyond the West African sub-region. So we were exporting vaccine. Today we import it. Milestone national development contribution from the medical laboratory scientists of Nigerian extraction. Before today, when we destroyed local content, because Nigeria had destroyed local content in healthcare delivery. That's why everything is important. And I expect that before President Muhammad Buhari will exit, let him interface with medical laboratory scientists. We will help the president revamp local content for the health sector and many other science-based sectors in Nigeria. I give you an example. Before now, when we had the first, recession, not this one, when Nigeria lost it and we went into recession before the days of Abacha and all those, we had medical laboratory scientists who had commenced the production in country of reagents for chemical pathology analysis, that is for biochemical analysis of human biochemical parameters. Some of them are living. They were not encouraged. We had colleagues who had commenced the design and development of medical laboratory equipment in country. So the value we bring is a lot. Nigeria is the second consumer of medical equipment and diagnostics in the African continent after South Africa. is second only to South Africa as the leading importer of medical equipment and diagnostics. And I can also say at this point that we have become the dumping ground for substandard medical laboratory equipment, diagnostics, and kits. For which reason you have the challenge of unreproducible results. When I use the word unreproducible, unreliable test results. It's not because we do not have the right caliber of professionals in most of the laboratories. It is because we have substandard, the kits are not validated, the equipment are not calibrated, and they are deployed. Why are they not calibrated and validated? Because medical laboratory scientists are not in charge. We should be looking inward. What can we do with what we have? We have the human resource. We have the natural resource. The only thing missing is the political will. You talked a lot about rivalry. I have a few friends who are on the other side. The immediate past president of the Nigerian Medical Association, Professor Francis Fadile, is my personal friend. We had discussed this, and I think we can sit on the table and reinvent the good old days when doctors lectured medical lab scientists lectured doctors. I know doctors practicing in Abuja here who had issues with their pathology exam, and I took them to my room as students and showed them slides and helped them, and they passed. Today they are doctors. So it is the dividing line between medical lab science and doctors is too thin. And let us not either obliterate it or emphasize it.
You mentioned a point earlier where when they are lauding the achievements in the health sector, they tend to forget medical laboratory scientists. So I'm wondering, should some of that blame be on laboratory scientists themselves in terms of selling yourself? I'll give you an instance. When patients come to the hospital, they will say, they don't even know what to call laboratory scientists. You hear somebody say lab person, or they will say lab people. So is that not a lapse on the side of laboratory scientists in terms of putting themselves out there?
If you don't say I am, nobody says thou art. Part of what we owe the people is to tell them who we are. There has to be a conscious effort to tell people who we are, what we do, how we care for them. So, who is a medical lab scientist? A medical lab scientist is a medical professional with sound knowledge in medical education. So, a medical laboratory scientist is not a lab man, a lab woman, lab people, lab technician, lab boy, labist. No. He's an integral member of the healthcare professional team, the medical team that cares for you. As a copper in State House, the physician to the head of state then, Dr. S.S. Wali, would not do a word round if the medical lab scientists are not accompanying him.
Wow.
He trained abroad, and that is the tradition.
So why wasn't this pastor?
He will not do a word round if the hospital dietitian is not accompanying him. He will not do a word round if the medical radiographers are not accompanying him. So when they get to the bed space, they had pathologists. One person who eventually became head of state of this country had a diabetic coma. I attended to him as a copper. And I can recall when Dr. Wali grilled me on the glucose chart I produced, because he wanted to marry my glucose values with the meals he was being given. That is holistic care, not what we do today. Word round is not only for clinicians. That is why, do you know where they rank Nigeria? 187 out of 189 ranked countries, because we do the wrong things here. Nigerian doctors see medical lab scientists as artisanal people. So the impression the patients have is not because medical lab scientists are not telling them who they are. It is sold to them because they come to say, and I have listened to them say it before me and I contested it, that when you come to the hospital, you came to see a doctor. That is a big falsehood. When you come to the hospital, you have come to seek health care, not to see a doctor. Doctors are just part of those who will deliver the health care to you.
Maybe they are coming from the point of team leaders.
I think I said that before the Minister of Labor and Employment recently. And I said, the team lead is not the boss. The team lead is first among equals. The captain of a football team is not the most valued player. He's also not the boss of the team. He is first among equals. The president of the Senate is not the boss of the senators. He is the first among equals. And this is leadership. Leadership is when you de-emphasize yourself and emphasize others.
If today you're made the Minister of Health, what is it, that one thing you can do for the medical laboratory profession to make sure that the profession is operating optimally in the country? We'll speak to medical lab science, then we'll speak to the health sector.
Yes. I will be speaking to what I will do in the health sector. I will bring everybody to the table. We have not had a Minister of Health that had brought everybody to the table.
Oh, how about Eyita Yolambo, Professor Eyita Yolambo?
Oh, yes. Eyita Yolambo attempted a feat that no other Minister of Health after him, in fact, even before him, had dared. He's in a class of his own. So, one of the things I will do for medical lab science is to reinvent our role in caregiving. I'll give you an example. Gradually, patients are being removed from interfacing with medical lab science. It's a disservice to the healthcare seeking members of the public. You know why? I'll give you a simple experience I had. There was a case of neonatal jaundice, and I had bilirubin values. And the pediatrician, one of the best then, I don't want to mention her name, she's from Cross River, she was also in the State House, felt otherwise. And by the time I took her to the cycle of bilirubin and brought her back to where the child was and the state of the child and the value I have, she accepted the values, modified her protocol for treatment, and the child was discharged within 48 hours. That is the value we bring to care.
Teamwork.
Now, one of the things that is happening is that you take sample, you go and drop it in the lab. I can, in the process of taking sample, look at a patient and tell you, doctor, did you notice this? Just that I pulled the sample and it is icteric. I said, doc, look at this sample, is icteric. I have not even run any assay, but you draw the sample, you come and drop it for me. That interface don't happen. So I am going to reinvent. I just told you that in the days of the open heart surgery in Enugu, it was never done until Jack Wallis mounted the gas station to provide the values. Today, if you move around our teaching hospitals, how many of our teaching hospitals have blood gas value stations that are working, that are supporting the theater? I will reinvent it to better the health of Nigeria. Why do Nigerians go abroad? Medical tourism is promoted because of want of investment in medical laboratory service or medical laboratory care. Once we're able to restore investment, bring investment into medical laboratory service, we will cut medical tourism by 70%. So people go abroad so they can get reliable data about their health status. There is no other reason why they go abroad. They are not going to see fine faces abroad. There are beautiful and handsome people in Nigeria.
So to round up what you just said, for medical laboratory science, you reinvent the role of medical laboratory scientists
to better serve Nigerians.
To better serve Nigerians. Then for the health sector in general, you will attract more investment in health.
And first, bring everybody to the table.